Hello everyone, my name is Francesco Maisano. I'm here with Thomas Modine and Philipp Lurz, and we are talking about the Mitral Focus Group. It's a new PCR focus group which has been established recently, and I ask you, Thomas, what is the inspiration behind this new focus group? What is the need that we need?
So the Mitral Focus Group was born based on huge unmet needs in the field of mitral care. Despite years of progress and innovation, we still are facing challenges in imaging, in standard of cares, and achieving the goals which even are addressed and accepted by the guidelines. So we wanted to create a dynamic, we wanted to create a group of people that helps guiding and shaping the future of mitral therapy and mitral disease.
Okay, Philipp, and a focus group is a concept today which has been somehow established 5 years ago with the tricuspid focus group, and there is usually a clear mission. So what is the mission statement? What is the objective you want to achieve as a team in the next few years?
Yeah, so obviously most importantly, and coming out of all the limitations and unmet needs Thomas already alluded to, is the aim to improve the treatment of patients with mitral valve disease. And to do so, we believe it's important to form and put together a common framework to help to unify some of the definitions, to foster innovation, to help with education about the disease, about how to perform the procedures, but also forming a platform which helps to collaborate, because it's also clear that it won't be one discipline which can solve the problem. We need intervention, we need surgery, we need imaging, we need heart failure, we need EP, so all the disciplines which belong to the team for those patients who have complex disease and are in need.
It is somehow surprising that mitral comes after tricuspid. It looked like it was a done deal to some extent. So where do you think are the main challenges you are facing today in the focus group? What are the discussions that you are entertaining at the moment?
Yeah, I mean, more than 20 years after the first transcatheter edge-to-edge repair, we're still navigating without a clear direction. So what we would like to achieve together in this group, which is a group work again, is bridging the gaps between heart failure, interventionalists, surgeons, and imaging. And actually, it's a growth plateau that we have reached today. And we are able now, looking from above, to identify where are the needs. We know that we need to advance more on the imaging skills. We know that we have to standardize the directions. Still today, we don't know if it's better for surgery, if it's better for transcatheter, and even if it's transcatheter, if it's repair, and which type of repair on this. So our mission, because this group is a mission, is to bridge all these groups together and cover the gaps.
With tricuspid, it was important to create evidence and improve the awareness of the disease. Here it's a little bit better. I mean, by no means we are done with evidence, but we have much more evidence. And also to some extent we have quite clear guidelines now, but now it's about implementing the guidelines. It's about applying the evidence we have. It's about outreach to other disciplines. It's about spreading the news. It's about educating those disciplines who see those patients first. That's one of the most important, for me, missions of the Mitral Focus Group.
The Mitral Focus Group has been designed similar to what was the tricuspid, gaining from the experience we had in the last 5 years. Can you just clarify how the structure, who is involved, how are you structured, and how it functions basically a focus group? You know, what is a focus group? How is structured?
Yeah, so the example of the very successful tricuspid focus group is very important for us. We start now with a team of 42 physicians coming out of different disciplines. As said, obviously intervention, surgery, heart failure, EP, imaging, all the disciplines. we have different tracks with leaders focusing more on innovation, on the procedure, on patient pathways, on imaging. And one of the starting points is now us drafting a statement where we try to agree on what we have achieved, where we try to unify some of the definitions, but also clearly outline what we want to achieve in the near future.
So, if I understand, Thomas, you are working on a kind of a state-of-the-art publication similar to what was a one-year achievement of the focus group tricuspid, correct?
Yeah, absolutely. And this state-of-the-art is based on the analysis we have done. So we wanted to know what level of evidence we have, and we have identified some objectives, urgent ones for midterm and long term, and this is what state-of-the-art paper will be looking at.
So achievement till now is you are working on alignment among physicians inside of the working groups, and soon there will be publications. So final question for any of you, Thomas or Philipp, what is your wish list? So what are you expecting to happen in 2026?
My wish list is that even in the short term that we can make a difference, that we as a community agree on what we want to achieve, that we can agree that having the guidelines is not the end to it, that we now have to work hard to spread the news, to educate the community, to improve the outreach, to implement webinars, maybe also have a mitral valve day where we have multiple events around the globe. That would be my wish for next year, what that group could achieve.
Yeah, we have created a dynamic, and my wish list is that this dynamic that we created is now looking in the same direction between all these groups, which was the biggest piece of the cake that we had to achieve together. But we are very confident about the way we want to go, and this is and there's no time limit, there is no agenda, but we have an agenda, but there is no limit in the ambition that we have for this.
Okay, so congratulations for what you achieved till now. Good luck for the future, and stay tuned with PCR events. I think this is a new endeavor of PCR. PCR Mitral Focus Group is going to allow us to grow together, to build together new knowledge, new evidence, as well as to educate the broader community in fields which are still debated, to try to bring some clarity in field of debate. Thank you for your attention, and talk to you soon again.
Thank you.